Okay, we will move on to our program, Homelessness in Our Area. Shawn Griffith is the Homeless Program Coordinator for the City of Knoxville.
So how did we get here? Homelessness is the result of multiple system failures in our society and policy decisions that date back nearly 60 years. These system failures include our healthcare system, our mental health care system, our criminal justice system, our housing system, our legislative and judicial system, and our economic system here in the United States. Deinstitutionalization back in the 1980s with the Reagan administration essentially left us with community-based mental health care, but we have struggled as a society to really meet the needs of those who are hardest to serve. Here in Tennessee, we have, East Tennessee in particular, we have Moccasin Bend in Chattanooga. It serves 52 counties, and it has approximately, I believe, 140 beds. If individuals have felony charges, depending on what those felony charges are, it is incredibly difficult to house some of those individuals and get them in. And as Chief Noel has said, and many others, we are not going to arrest ourselves out of the issue of homelessness. The way we're going to work ourselves out of the issue of homelessness is through housing solutions and getting people into housing and providing supportive services to help them maintain housing. Once individuals are experiencing homelessness and out in the street, it becomes a very complex situation to try and get them the supportive services they need. One more thing, they have past and present trauma, and then they're a highly vulnerable and marginalized population. And I will say the caveat that while these individuals are highly vulnerable, they're also a highly resilient population. So what you see here is data from our Knox HMIS system, that's the Homeless Management Information System. The top one by far is individuals saying there's no affordable housing. They do not have the income to be able to afford housing in our community. The second one is physical and mental health issues. So this can be individuals that have entered our hospital system and they have significant needs that they can't afford to meet. They may lack health insurance and now they're in debt. Third is eviction, and this is continuing to rise right now across the United States. Eviction rates have now surpassed pre-pandemic levels, and this is going to lead to the surge in homelessness that we are currently experiencing right now. So the national shortage to have essentially a healthy housing market, we are missing 3.8 million households nationwide. Now nationally for affordable housing units, which is different, this is the number of units we need for individuals who have low incomes to be able to afford to live in the housing they currently are in, is 7 million units nationwide. So what that means is that if there is a lack of rental housing and it is severely unaffordable, you're going to see a dramatic rise in the number of individuals experiencing homelessness in that community. For every $100 rent increase that you have in a given community, you're going to see a 9% increase in the number of individuals experiencing homelessness. And this puts us in a very, serious situation when we start to talk about what the local context is here in Knoxville. And then the number of affordable and available rental homes per 100 extremely low-income households is 46. We are primed for increase in people experiencing homelessness. Cost burden means that individuals are spending more than 30% of their income on housing. 12,000 of those households are extremely cost burdened, which means they're spending more than 50% of their income on housing. And to just serve our chronically homeless, individuals with severe service needs, we're at a deficit of 454 units of permanent supportive housing. We are experiencing a dramatic increase in home prices and rental rates. You can see at its high, it's roughly 29.2%, roughly 30% for both categories. One thing that is also currently happening is that many of the units that renters were living in, the value of their home went up so drastically that those that were owning those homes decided to sell them. And so we have a lot of individuals who were in rental housing that were stable, who are now hitting our homeless service system because their houses were sold and their leases were not renewed. So what this chart is showing is essentially if an individual is renewing their lease or if the individuals are signing new leases. New leases are upwards of 35% increase in their rent. And if individuals are renewing their lease, it's hovering around 15%. What would we expect to happen? We see a dramatic increase in the number of individuals experiencing homelessness. Our pick count is a count that's done on one night of every year. It's usually done in the last week of January, where we go out and we attempt to count every single individual experiencing homelessness in our community. And this chart is showing the last 20 years of that. But as we can see, as the housing market has rapidly increased, we have seen a dramatic increase in the number of individuals experiencing homelessness in our system. So for our sheltered population, we're currently at 805 individuals on that night in February 2022. And we had 373 individuals experiencing unsheltered homelessness, totaling 1,178 individuals. And what we're also noticing, which is a trend nationally as well, is we are seeing an increase in the number of chronically homeless individuals in our system. And all of this, again, is coinciding with the current conditions of our housing market and the economic system, what's happening right now.